Good morning, students. Today's class we will see the remaining portions of medical surgical nursing give reason. The first question, continuous control hyperventilation is the mainstay in treatment of increased intracranial pressure. Whenever there is an increased intracranial pressure, the complicated course of various forms of cerebral edema, the likelihood of survival with full recovery is greatly diminished. So, controlled mechanical hyperventilation effectively lowers the ICP in patients by causing cerebral vasoconstriction. The theory behind it was that by increasing the respiratory rate and decreasing the partial pressure of carbon dioxide in the blood vessels in the brain would constrict. So that will lead to a reducing blood flow and therefore reduce the intracranial pressure. Increasing hypocapnia via hyperventilation reduces the partial pressure of carbon dioxide. But the recent research showed that hyperventilation may actually may harmful effects on the brain, such as reducing the blood flow and oxygen delivery to the brain tissue, which can cause further damage. Therefore, hyperventilation is no longer considered the mainstay treatment for the increased intracranial pressure. It was considered in the earlier, but now it is not considered. So we'll go to the next question. Next question is, immunosuppressants are given to patients after renal transplantation. Why? Immunosuppressants are the drugs or medicines that lower the body's ability to reject the transplant organ. Rejection occurs when the body's immune system recognizes the new organ as an invading threat. So in renal transplantation, the person is carrying someone else's kidney. So there is a likelihood of rejection from the patient's side. So to reduce that, we use the immunosuppressants after renal transplantation. Next question, squatting position is preferred by patients with cyanotic heart disease. Why? The cyanotic heart disease is any heart defect present at birth and reduce the amount of oxygen delivered to the body. So such type of disease are called the cyanotic heart diseases. Squatting increases the peripheral vascular resistance, in short we call it as PVR, and thus decrease the magnitude of the right to left shunt across the ventricular septal defect. So, squatting serves to increase the peripheral vascular resistance, thereby increasing the pressure in the left heart and subsequently forcing blood back to the pulmonary circulation. So, the more oxygen will go for the oxygenation and the body will get more oxygen after the purification. So, that is why squatting position is preferred by the patients with cyanotic heart diseases. Hourly urine output is monitored after cardiac surgery. Why? Hourly urine output is an important parameter to monitor after cardiac surgery because the kidneys plays a critical role in maintaining fluid and electrolyte balance in the body, and any change in the urine output can indicate potential problems such as dehydration, kidney dysfunction, or inadequate cardiac output. However, after cardiac surgery, higher the urine output goals may be sent to ensure adequate fluid removal and prevent fluid overload, which can be detrimental to the cardiac function. So, we have if the kidney is not able to remove the fluid after cardiac surgery, it may lead to the fluid overload and it may increase the cardiac workload. So the heart is not able to work so much after the surgery. That is why this information can help to guide decisions about fluid and electrolyte management as well as other aspects of the postoperative care. Next question, turn the patients on the side during episode of seizure. Turn the patient gently to one side. This will help the person breathe by keeping the airway clear since the diaphragm cannot contract. And turning the patient to one side during the episode will also help to prevent the aspiration of saliva, thereby helps to prevent the aspiration pneumonia. So turning will help the saliva or the fluid which is present in the mouth means leak into the outside, rather it go into the trachea if the patient lie in a supine position. So that is why we have to gently turn the patient to a side during the episode of seizure. In an intercostal drainage system, the water seal chamber should always contain at least 2 cm of water. Why? The water seal chamber acts as a one-way valve, allowing air and fluid to leave the pleural space during the exhalation but prevent the air from entering during the inhalation. The height of the water column in the chamber creates the pressure necessary to maintain the one-way flow. If the water chamber runs dry or the water is so low, the air can enter into the pleural space from the outside wall, which lead to the pneumothorax. At the same time, if the water level is too high, it can impede the flow of air and fluid out of the pleural space, which can also have negative consequence. So, the water seal drainage system, it should have at least 2 cm of water, not more but not less also. The next question, the patient on pacemaker should avoid sources of strong electromagnetic fields as large generators. Why? Pacemakers contain metal and therefore they are not normally allowed near MRI machines or large generators. Strong magnetic field from this large generator can interfere with the function of implanted devices, that is the pacemaker. This electromagnetic field can disrupt the electrical signals sent by the pacemaker to the heart, causing the heartbeat too fast or too slow or irregularly. Source of strong magnetic fields to avoid include large generators, MRI machine, welding equipment and some security system. Patients should also avoid placing the cell phone directly over their pacemaker, as this can also interfere with the device. Next question, LP. LP means lumbar puncture. Lumbar puncture is not done for the patients with symptoms indicating severely increased intracranial pressure. Lumbar puncture is generally contraindicated in the patients with symptoms indicating severely increased ICP because it can potentially cause brain herniation. The lumbar puncture involves inserting a needle into the lumbar region of the spine to collect cerebrospinal fluid for the diagnostic purpose. So, in patients with the increased ICP, the pressure within the skull is already elevated, and performing an LP can further decrease the pressure gradient and cause brain to herniate. So, to prevent a brain herniation, it is better to avoid doing an LP to a patient who is severely increased intracranial pressure. Next question. The body responds to hypoxemia by increasing the rate and depth of respiration. Why? Increased activity of chemoreceptors caused by hypoxia or increase in the partial pressure of carbon dioxide augments both the rate and the depth of breathing, which restores partial pressure of oxygen and carbon dioxide due to their usual levels. The body responds to hypoxemia by increasing the rate and depth of respiration. So, this is the compensatory action. So, when we take more breath, the more oxygen will come to the body. So, the oxygen available to the tissues will be increased. So, that is the main principle behind the body response hypoxemia by increasing the rate and depth of the respiration. When the rate and depth of the respiration increase, the more atmospheric air with oxygen will come into the body, and there will be increased oxygen availability to the tissues. Next question. Do not try to lift a person during seizure. It is important not to try to lift the person or restrain from their movements, as this can potentially cause both the person who is having the seizure and also the person who is attempting to assist them. The increased chance of them suffering an injury as broken bone or dislocated shoulder. In addition, it puts the person at high risk of sustaining an injury. So, it is better to try to lift or restrain the movement during seizure. So, both the patient and the person who is going to do that also will get injured. That is why it is do not try to lift the person during the seizure. Thank you. We will see with another presentation. Thank you.